I am Claire Lavasek. I'm the manager of bilingual data partnerships at Mental Health Research Canada. Before we proceed, I would like to begin with a land acknowledgement. As we are a national organization, our work impacts many lands in Canada. I am welcoming you from the city of Toronto, which is located in the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. And we're most grateful for the use of this land. So we'll begin with a few housekeeping items, followed by highlights from our 24th National Population Poll on Canadians' mental health. Next, we'll hear from two leaders in the field, Akela Peoples and Amy Coupal, in a conversation focused on caregivers' mental health in Canada. We'll close the webinar with a Q&A session. You can submit your questions in the chat at any time during the webinar, whether it's about the major finding that I will be presenting or about the discussion on caregivers' mental health. My colleague Shona Major will be monitoring the questions and will address as many questions as possible during the Q&A session at the end of the webinar. So we'll be discussing mental health indicators broadly, but we will touch on some topics that can be difficult for some of you. So if you feel at any point that stepping away would be in your best interest, please feel free to do so. Also, this session is being recorded. So the presentation deck, along with the recording, will be available after this session. The recording will be uploaded to our website. Also, don't hesitate to reach out to us after the webinar. Whether you have a question or a suggestion for the next webinar, it's always useful for us when we plan the future webinars. So for those who don't know us, please let me say a few words about MHRC. Mental Health Research Canada is a national charity that supports research, a research aimed at improving mental health outcomes for Canadians. We work with many stakeholders, researchers, communities, and people with lived experience to turn evidence into practical solutions. So through data collections and funding for research and innovation, we aim to contribute to stronger mental health outcomes and supports for Canadians and aim at meaningful systemic changes across the country. One of our key initiatives is the Mental Health Population Pooling Project that is supported by Health Canada. This project enables us to monitor, analyze, and report on the mental health of Canadians. So today, I'll briefly present the latest findings from our 24th poll conducted in May 2025 with the participation of over 4,000 Canadians. These major findings, they are drawn from more comprehensive reports containing many additional insights that you can find on our website. Our findings are updated every quarter to reflect either current events or the ongoing collaborations we have. You can note that we make our datasets freely available to researchers, governments, and nonprofits, and everyone can access freely our public reports and our data hub in our website. So let's go over Poll 24 major findings before discussing caregivers' mental health in more depth. When we asked Canadians whether their mental health affects their ability to function on a day-to-day basis, nearly 1 in 3 of them said yes. You can see here in blue, 28% said yes. When mental health impacts people's ability to function at work, it commonly results in absenteeism and a decreased productivity. As we can see on this slide, nearly 1 in 10 working Canadians, 9%, reported missing work the week before the survey because of their mental health challenges. On average, they missed nearly 3 days of work that week. And when we look at students, 13% of them said they missed school for the same reasons. In addition, 1 in 4 workers, 25% said their mental health affected their productivity during that week. So they were able to come to work, but although they were at work, they could not focus on work because of their mental health challenges. They felt unproductive for an average of almost 3 days that week. And when we look at students, it's even higher, as 36% of them said they felt unproductive because of mental health challenges. So these findings, either absenteeism or presenteeism, really underscore the substantial impact that mental health challenges have on workforce attendance or productivity. Moving on to a very current topic with the US tariffs. So as we can see on the top right chart, 38% of Canadians said that the implementation of the US tariffs have had a negative impact on their mental health. When we asked why, they shared the following concern. Most of them, they're worried about the broader economic and geopolitical consequences in the future. You can see line 1, I'm concerned about the wider economic impact for 65%. And line 3, I feel stressed about the geopolitical tensions. Also, half of them say they've been affected by the rising cost of living linked to the tariffs. Line 2, 55% say I've been affected by higher cost of living. But also some suffered direct financial or job losses. Line 4, we can see that 32% experienced financial losses. And at the bottom of the chart, we see that 5% said they've lost a job due to the tariffs. And another 18% fear they could also lose their job. So what's interesting here is to see how the tariffs have translated into everyday economic stressors and pressure that contribute to psychological strain. So it really highlights the importance of incorporating economic stressors into mental health strategies. Looking now at screen time, we see on the left chart how many hours per day each age group spends on screen for personal use. On the right, we can see how many hours a day each age group spend on screens for work or study. So on the left, we see that Canadians spend an average of 3 to 5 hours per day on screens for personal use. We can see that the younger age group tend to spend a little bit more time on screen for personal use than the other age groups. When we look at screen time for work and study, we can see that Canadians in the age of either studying or working spend between 3 to 9 hours a week on screen for these purposes. What was interesting for us was the correlation between screen time and mental health. And we can see that increased screen time for personal use is correlated to a worsening mental health, while increased screen time for work and study is not. So if we look at the next slide, we can see on the left charts that people who spend 6 or more hours a day on screens for personal use, they are 4 times more likely to experience severe anxiety symptoms compared to those who use screen for less than 2 hours a day. So if you look at the left chart, the left column, we see that 17% of those spending 6 or more hours on screens for personal use experience severe anxiety symptoms, when only 4% of those spending 2 hours or less. It's the same for the severe depression symptoms. 22% of those spending 6 hours or more, only 8% of those spending 2 hours or less. They are also twice as likely to show signs of alcohol or cannabis dependency. In contrast, if you look at the right charts, people who spend 6 hours or more a day on screen for work and study do not really report a worse mental health than those who spend less time on screens for these purposes. If we look at severe symptoms of anxiety, they're fairly the same. Symptoms of depression, they are the same. And though they do report slightly higher signs of substance dependency. So what was interesting to us is to see that it's not just screen time that is associated with poor mental health, it's personal screen time. If you spend time on screens for work or study, it seems that it's not associated with a worsening mental health. So we can wonder, is it what people do on screens during their personal time that negatively affect their mental health? Or is it because they're actually already struggling with their mental health that they spend so much time on screen during their personal time? So it's a topic that will be really interesting to keep investigating on. The final topic covered in our poll's major findings is caregiver mental health, which serves as a very good transition before Akela and Amy discuss it in more detail. So our polling shows that 27% of Canadians identify as caregivers. That is, they provide care to someone with a disability or an adult, and we refer not to a profession, but to personal circumstances in their lives, whether in their household or personal network. We can see that 40% of them spend 10 hours or more each week providing support. So it's a very big commitment that has an impact on their well-being. As we can see on the right, 32%, one caregiver in 3, report feeling burnt out, compared to 22% of non-caregiver. The challenge is that many caregivers are not getting the mental health support that they need. We can see here on the left chart that 22% of caregivers said they needed support in the past year. Of those, just over half, 13% in red, accessed it, while nearly half, 9% of them did not. By comparison, 3% of non-caregivers needed mental health support and did not get it. That means that caregivers are 3 times more likely to go without the support they need. Caregiving also affects work, as nearly 1 in 3 caregivers, 23% on the right chart, said they've missed work or they experience reduced productivity at work due to mental health challenges, compared to 18% of non-caregivers. So here's a summary slide about the data that we just talked about regarding caregivers' mental health. One point that I haven't mentioned is about the financial cost of caregiving, as caregivers are facing increased financial strain. Here we can see in the last bullet that 43% of caregivers are worried about not being able to pay their bills, and if I recall correctly, it was 36% among the non-caregivers. So this brings us to the second part of our webinar, where we'll take a closer look at caregivers' mental health and their need for support. I'm honored to be joined by 2 leaders in this space, Akela Peoples, CEO of Mental Health Research Canada, and Amy Coupal, CEO of Ontario Caregivers Organization. They will share insights on the current state of caregivers' mental health and how to improve supports across Canada. So with that, I'll now turn it over to Akela and Amy.
Thank you so much, Claire. That was a wonderful overview, and I'm so proud to work with such a tremendous team of individuals who care deeply about the work that we're doing. We feel we're really making a difference by collecting and rapid reporting on data and keeping Canadians, governments, and other stakeholders across the country up to date about how Canadians are feeling about their mental health. I just also want to mention that my colleague Shauna and possibly my colleague Michael, if needed, are both on standby. They'll be helping with the question section a little bit later after Amy and I have a chance to have a chat. So Amy, it's wonderful to see you. You and I have known each other for many years. We've both spent quite a bit of time in the charitable nonprofit sector. We're very connected to our work, and it's wonderful that we were able to intersect again on this initiative. So thank you so much for the work that you're doing and the work that your team is doing. Thank you for being here today and making it a priority to share your expertise on this important topic. And maybe we could start out. I know we have over 320 people registered for today's event, joining us from coast to coast to coast. And as Claire mentioned, we are recording this and we'll have this available on our website. And we'll be posting in social media in the coming days to direct people to it if they were not able to attend or if they want to forward it on to colleagues. So it lives on beyond our conversation today, which I think is very important. So Amy, maybe you could tell us a little bit about Ontario Caregivers Organization. Let's start there.
Sounds great. And thank you so much for having me. I really appreciate the opportunity to have these conversations with people like you who are doing such important work in this space, and for our respective organizations who I think are addressing some of the core issues in our society and of our time. But I am also really appreciative of the people who are here with us live and who are watching this recording, who are thinking about this perhaps in terms of their personal circumstances or professionally. I'm grateful for the opportunity to have these conversations. So The Ontario Caregiver Organization, what we do is we support Ontario's current 4 million caregivers. So these are family members, friends, and neighbors who are providing physical or emotional support to someone in their lives. And that may be, someone like me, where I'm caring for a parent who's an older adult. It may be someone who's caring for a member of their chosen family. It may be somebody who's looking after a neighbor down the hall or down the street. And so what we do is we support the caregivers. We provide information, resources, and free programs and services wherever people are in their caregiving journey. So they can call our 24/7 helpline or visit our website at ontariocaregiver.ca, find out what we have available to support caregivers in that journey. And then also there may be resources and information we can provide to help the person that they're caring for. So this is obviously very meaningful for me. I've been a caregiver for most of my life, and I'm really proud of the work that we do to support caregivers and also to work with our system partners to raise awareness about caregivers and what they need in our healthcare systems and in our communities.
Wonderful, thank you. And we do have your website address on this slide, and we'll make sure that we circle back to that and talk a little bit more about resources and what might be available on your website before we close things off a little bit later on. Now, I know your organization collects data each year, and we collect data ongoing. And our data shows that nationally, 27% of Canadians identify as caregivers. And just to reiterate what was mentioned a little bit earlier is as we define caregivers for purposes of this work as unpaid caregivers. So people who are caring for, as you've mentioned, friends, families, neighbors. And also it excludes parents of able-bodied and able-minded children. So we're not talking about parents who have children. Parents who do have children who have special needs would be included in the conversation today and in the group that we're talking about. So 27% of Canadians, according to our data, identify as caregivers. Amy, why is this group so important to our society?
Well, caregivers are really the backbone of our healthcare system. Caregivers provide 75% of care, and that might be at home, in hospital, in long-term care, wherever that care is taking place. Caregivers are often involved in making sure that people get the support that they need. So we really are vital, whether it's around system navigation, coordination, medication management, paramedical tasks. There are so many different things that caregivers do at different phases of the caregiving journey, and we are so important. We often do this quietly, silently, unrecognized, but our system is built to rely on caregivers, and we're needed, especially now more than ever, as we see, as your reports have shared, increased challenges around mental health, our changes in demographics, increase in chronic illness. Caregivers are essential.
Yes, thank you. It's quite amazing, really, when we think about the significance of this group and the number of Canadians that identify. And I suspect there are probably caregivers that don't even realize they're a caregiver. Is that something that you would agree with in your organization and your work?
Absolutely. I will say, usually at least once a week, I will be in some kind of conversation and people will say, "Oh, I just realized I'm a caregiver." And
Wow.
it happens still all the time because people say, "I'm doing this because it's my mom, it's my spouse, it's my child, whatever it might be." And they do it because of that relationship or because they care about that person in their choir or the neighbor down the street. And that's great that we have those relationships and then we step up and provide support when it's needed. But it's important that we identify as caregivers because it helps to inform our conversations and our
Absolutely.
plans.
Right, absolutely. Wow. Once a week, you're saying in Ontario, your organization is hearing from somebody who doesn't really hadn't realized that they're a caregiver.
Just say anecdotally, that's my experience
Yes,
in talking with people, that it happens all the
all of
time,
a
that
sudden.
the penny drops and people realize, oh, I'm a caregiver. So we know that caregiver self-identification is something that doesn't happen as often as it should. And it's one of the reasons that we work with our health system partners around that important step of caregiver identification.
Right, acknowledging that work, right. So that's amazing. So this 27% may even be much larger. We don't even know. But even 27% is a significant number. So from your vantage point, if you had to guess, would you see this number, 27% of Canadians, do you think that number is going to be decreasing or increasing over the next while? What are your thoughts on that?
Well, I don't have to guess, to be honest, because we know from research that we did last year, we do an annual report on the state of caregiving called Spotlight. And last year, we released an additional report called Preparing to Care. And one of the things that we released in that was that we anticipate the number of caregivers in the province of Ontario alone will increase from our current 4 million to 6.5 million by 2030, which is really just around the corner. So we know as a result of the changing demographics and many more older adults who may require care or support in some way, shape, or form, as well as increased incidence of chronic illness, that caregivers will be growing across our country. There will be many more people stepping up and providing care, and they need support.
It's even more important that we get the necessary supports in place and the pathways to support. You mentioned demographics. Talk a little bit more about that. Is the demographic of the caregiver changing? Are there different cultural identities or communities where caregivers are more a part of the family unit? Or do you have any comments or thoughts on that?
A really interesting question. So, a few thoughts. First of all, we know that caregiving can show up at any age and stage of life. There are young caregivers who are providing care often at a very young age, and we hear of children who are providing care in the home, whether that's perhaps for a parent, a sibling, a grandparent, an aunt, uncle, at very young ages. So, it can happen at any age or stage, but we also know that two large populations of caregivers would be older adults who might be providing mutual care to each other, as well as the sandwich generation, which is a large portion of the population. I would fit into that category where I still have children at home, but I'm caring for a parent who's an older adult. So I'm the sandwich in the middle. So those are two large populations that we know exist within the caregiving population. But to your question about sort of the uniqueness of caregiving circumstances and demographics, certainly culture plays a significant role, and there are different cultural norms and expectations around caregiving. In certain cultures, there isn't a word for caregiver because it's very incorporated within the culture and the context. And we also know that there may be different expectations and requirements of where people fit in the family order or their gender around caregiving. So we certainly work with caregivers around some of those nuances. We actually created a set of adapted toolkits where we worked in partnership with different communities to create resources in different languages that reflected some of those nuances, because this is not one size fits all for anybody.
And I suspect some of those toolkits would be on your website.
They
So
are.
folks can visit those to access those free of charge, download them, and sort of start their journey to personal acknowledgement and getting the support that they need. What kind of tasks are you seeing caregivers are assuming in this role?
I can say from personal experience, and this also is reflected in the data, that caregiving tasks can be quite wide ranging and diverse, and that they may not always be the same across a caregiving journey. Many caregivers are doing that care coordination system navigation role, trying to determine, what's needed. How do I get booked in with different specialists, healthcare providers, et cetera? And they are kind of the hub at the spokes of that wheel, trying to get everything together. They may also be information managers, because when we live in a world where not all of the systems are interoperable, they may be the one who says, here's the records from over here that are relevant to this conversation. We still know there are caregivers who show up with their binder of printed records to make sure that healthcare providers have the history and the information they need. But caregivers may be providing all sorts of supports in terms of supporting the active acts of daily living for someone to live their best life independently with family, etc. And they may also be doing a number of paramedical types of tasks. So it's quite varied and can really change over time depending on the needs and circumstances of the person they're caring for.
And so I suspect even simple things like going out to get groceries, going out to get medications. I know from my family unit, the caregiver that I have connection to spends a lot of time driving to appointments, to medical appointments. That's an ongoing task and a big responsibility. So a very broad range of tasks here we're talking about, and not a one size fits all, many different things to encompass caring for someone who needs help and support. So 40% spend more than 10 hours a week doing these tasks. And the average work week is 40 hours. So that's, if somebody has a full-time job and they're also providing caregiving support, that's a substantial amount of time over the course of the week. Our research shows that 32%, so 1 in 3 caregivers report feeling burned out. Is your data showing that as well, or what can you share about that with us?
You've acknowledged a number of important experiences that caregivers have. One is that more than half of caregivers work. So working caregivers are balancing those caregiving responsibilities with their work responsibilities. We know that there are caregivers who are concerned about losing their job or having to leave their job because of their caregiving responsibilities, or who may need to cut back on their responsibilities as a result of providing care. And many caregivers are balancing, juggling work, care, and perhaps a host of other responsibilities. And so that is an important consideration around the nuances related to that. Can you just remind me what the second part of your question was?
So I was mentioning that our data shows that 32% of caregivers reported feeling burned out, and that's comparable to 22% of non-caregivers. So it's a substantial difference. So obviously they're juggling a lot of tasks, and as you've mentioned, so many of them, a high percentage, are working and holding down a full-time job, and then have, these, in some cases, 10 hours a week or more responsibilities on top of that. So it's, I think, natural to see very easily how they could become burned out. And this is, on top of, all taking care of their own life, perhaps their own families and their own children. If they're caring for a neighbor down the street, or, an elderly relative, they still perhaps have their own children to manage. So it's almost very easy to see how burnout is a problem. So I was just commenting on burnout, and if your data is showing the same thing.
Absolutely. So I think one of the most stark statistics that we have seen evolve in our own research is how much faster caregivers are getting to burnout. So our first year that we issued Spotlight was in 2019 in collaboration with the Change Foundation. And at that time, caregivers were getting to burnout within 5 years. We now see in our most recent research that caregivers are getting to burnout in 2. And I really feel like this is one of those things that we should all be paying attention to, in terms of, if caregivers are getting to burnout faster, what does that mean? Well, what does it mean in terms of why they're getting burnt out so much more quickly? We certainly have some ideas about why that is. Also, what does it mean when they get burnt out? Because we know that if a caregiver is burnt out, it is going to significantly impede or perhaps block their ability to continue to provide care. And then what happens to the person that they're caring for, right? In terms of the needs that they're providing, whether that's around living circumstances, healthcare, etc. So burnout is a significant concern. The trend is not our friend, as my dad would say. And we have so many sub pieces of this in terms of the greater risk for caregivers around depression, around anxiety. And so we get quite concerned about caregivers becoming patients themselves as a result of the caregiving responsibilities that they're taking on.
Mm-hmm. Why do you think they're burning out so much quicker now? I mean, that's not too many years, and that's a dramatic difference. 5 years now down to 2 years. That's significant.
Truly it is. And like I said, I think it should be a wake-up call for all of us. If we look at the stressors that caregivers are facing, I think that there is this sense of swimming upstream. The system navigation, care coordination, information management component feels like a huge burden for most caregivers. But the time demands, as we've already highlighted, grow for caregivers, especially when they might be on a waiting list or not able to access the sufficient level of care that they need, perhaps home care or whatever the circumstances might be. The other factor that we haven't talked about yet, which I think definitely plays into this, is the financial impact of caregiving. The average caregiver spends in excess of $600 a month towards caregiving. And that
Wow.
might be medical supplies, home care, costs
Yes, for their
of
car.
living.
Yes.
And some people are spending more than that. So that financial concern may be impossible for people to overcome. And the stress that that creates for people can be significant. So caregivers are balancing all of these pieces around time, around money, around their other responsibilities and commitments in their life, their own health and wellness. It's a lot to manage for a lot of people. And I think it's important to acknowledge that.
Absolutely. And with the cost of living being so high and being on the rise, I mean, $600 a month is significant, absolutely significant. Thank you for noting that. And great segue into, I know our data shows that 43% of caregivers are worried about paying their bills compared to 36% of non-caregivers. So that's a substantial difference as well. So this is a concern now. Now, why do you think this is that's so dramatically different? You think it's just a commitment to this role where they just see this as part of their life or part of their culture or an expectation? So they just take on the extra financial responsibility because they feel it's just part of who they are, just part of the role.
I think the answer to that really varies based on people's individual circumstances. So you highlighted actually some of the reasons why people might do it, right?
Right.
Some people are a caregiver because it's a labor of love.
I love,
For other
yes.
people, that's not the case. For some people, it's an obligation.
Ah,
And,
interesting.
I think it's really important when we recognize caregivers, the circumstances, their own thoughts and feelings about their caregiving responsibilities may not all be the same. And that's okay. That there is within this world of caregiving all of these different kinds of experiences. And how do we meet people where they're at and provide them with the support that they need based on the particularities of their circumstance. So it's not the same in every circumstance. And also people's ability to respond to the demand is not always the same. Right.
Right.
And one of the things that we certainly hear from caregivers when they reach out to us is there are people in incredibly challenging circumstances.
Mhm.
Financial is one of them for sure.
Mhm.
And if anyone has been a caregiver and taken on some of these financial responsibilities, they are very clear on how those costs can add up quite quickly. And not everybody has the capacity to manage that. And so this is really something for us to think about as a society in terms of what do
Mhm.
people need in order to receive the care that they require, perhaps to age in place, to age well, to recover from illness or accident. We need to talk about this as a society instead of kind of keeping caregiving quiet in the
Right.
background. It's happening in our homes and our communities everywhere.
Now, you talked about for some people it being a labor of love, and for others it being perhaps a cultural obligation. In the latter case, if it's an obligation, that may not be welcomed and could have serious impacts on someone's mental health if they feel they have no choice, they have to do something, there's no other option, and it's perhaps eroding their ability to achieve their own potential in their personal life or professional life. Um, so accessing mental health support is a key issue for caregivers. And if we're a quiet caregiver behind the scene and we haven't acknowledged that we're a caregiver, we're not going to be likely to access or even seek out any kind of support. So our data shows that 22% of caregivers say they need mental health supports, but almost half of them say they don't access it. And these are the people that are identifying as caregivers. This has got nothing to do with the people who are caregivers and not identifying that they are, or perhaps they're not aware that they are. So that's a significant issue as well. Why do you think this is that people who are caregivers are feeling mental health strain, know they need help, but they aren't accessing it? Is this just a factor of time? They're already busy because perhaps they have a full-time job and they're spending 10 plus hours a week caregiving. What's your line of sight on that?
Well, again, I think you've highlighted some of the early reasons that people might cite. Time is definitely one. Money is another.
Right.
I think also we did some research on this a few years ago related to stigma and why caregivers don't ask
Right.
for help.
Mm.
Uh, there, there is a real culture of caregivers being okay, right? When you
Mm.
actually ask a caregiver a first question of, how are you doing? Many caregivers will say, I'm okay. And then you start to dig deeper about what about this, what about that, what about that? And then it starts to reveal some of the challenges that people may be facing or navigating, right? And so I think we haven't normalized caregivers getting the help that they need. And we also haven't necessarily set up the system structures opportunities that enable them to do so in a way that works for them. You know, one of the reasons that we have 24/7 is because if your only time to call us is at 2 in the morning, we
Right.
want you to be able to reach us. Now, we are not a crisis line, but it is somebody to talk to at the other end of the phone who's there for you to help figure out, where do we go from here for you? And then organizations like ours, and there are others in some provinces across the country, BC, Alberta, Quebec, Nova Scotia, and New Brunswick, have caregiver organizations where they have different types of supports that they can connect you with, whether that's peer support, it might be coaching, it might be counseling, it might be, other ways that you can connect with caregivers. And we know from our own results, those things make a huge difference for caregivers to connect with the support that they need for them. But getting to that point can be a challenge.
I did not know that you have a 24-hour call-in line. That's outstanding. Congratulations on that. And I'm sure that that is greatly utilized. And, I suspect isolation and loneliness is probably a big issue among caregivers. And I'm going from personal experience in my circles and the caregivers that I know. And, you also touched on an interesting point about caregivers. Oh, yes, I'm fine. I'm okay. They're dealing with someone who has much bigger issues than them in their mind. So they often don't want to take the focus away from the person who's ill or the person that needs help that they're caring for. And they want to be stoic and say that they're fine. The energy needs to go over here to the person that I'm caring for. And this is an issue, this whole acknowledgement that as a caregiver, I might need help or support, or I might just need someone to talk to at 2 in the morning. I mean, you're absolutely right. We need to do work on the stigma element of this, because the family plan changes if the caregiver is not available to provide support anymore. It can often be a dramatically different plan if that caregiver is not available anymore or is not capable anymore of caring. So number of really important issues there that I think need unpacked and addressed, as you say, at the societal level, because if we don't keep our caregivers healthy and supported, we're going to be in trouble, because the system can't handle all of this support on a paid level. So a number of important issues there. Thanks for raising them. So, we are two organizations that believe in research and data, and how important it is to hear the lived experience voice. And I know that your organization is very in touch with lived experience. You're talking to caregivers every day, sounds like 24 hours a day. Our national data collection is focused on having Canadians report on their mental health. So the whole amplifying the lived experience voice. What other research do you think is needed in this space? I know that you do your spotlight report every year, and I hope some of our listeners will look for that on your website. I know it's Ontario focused, but these issues are relevant in other provinces. What other research do you think we need to look into? What do we need to understand more about this issue?
So, a few things. One, I do want to recognize that we have other sources of data. Even StatsCan is pulling good data, increasingly so around caregiving. The Canadian Centre for Caregiving Excellence is gathering data for around caregivers in Canada. And we need to continue to gather that data, but also put it into knowledge and action, right?
Mhm.
And I think, we know a lot of things about caregivers. We know a lot of things about who they are, what they need, their role within our healthcare systems and our societies. And I think it's important to talk about what we're going to do with the data that we have, right?
Right.
So I'll give you an example. We know that caregivers make a difference in healthcare outcomes in every healthcare settings, hospitals, long-term care, primary, home and community care. We also know from research evidence what strategies make a difference. So one of the things that we're doing through our Essential Care Partner Support Hub is actually helping those healthcare providers to work on those evidence-based practices and how they can implement them within their settings. So we need to keep our data current, and we need to make sure that that data is brought to the table in the right conversations around policy and
Right.
practice, and actually bring it to life. Right. And this is
Mhm.
one of the things that we hear from caregivers. If you're going to ask for our insight, please tell us how you're going to use it.
Yes.
Right.
Mhm.
And I think that that's a fair ask.
And, a big part of that is translating it into a format that's easy to consume for the average person. And that's a big focus of our work across our organization, is making sure that we take academic information, research data, and put it into a format that anyone can read and use and apply. And I think that's a really big, important point for us to underscore. So anyone who's listening that may be in a space where they're just starting to explore this journey, what advice do you have for someone who's newly a caregiver, or maybe has a caregiver in their family that they're worried about? What advice do you have, Amy?
So, a couple of things. For new caregivers, I would absolutely connect as early as possible to supports that are relevant to you based on your circumstances. That may be from an organization like ours, other caregiving organizations. It may be organizations that are relevant based on the circumstances of the person that you care for, like Alzheimer's or cancer or whatever the case may be. So, connect with those resources and supports early and often would be one. But I'd also like to call out people who anticipate that they may face caregiving responsibilities. So perhaps, they're thinking about aging family members, that kind of thing. I think it's really important to have conversations about preparing to care and what people's wishes are, what people's plans are, managing people's expectations about what you can do as a caregiver, and how we actually make that work. So I'd love to see more conversations happening about caregivers and caregiving, and what we expect and need from each other in these types of relationships. I think that that's really important.
Wonderful, thank you. And I know we've touched on a couple of things that your organization provides in terms of what might be available. Anything else you'd like to share around what resources that you have or what's available on your website?
I think one of the things we've tried to prioritize is for there to be something for anyone at any stage of the journey. So whether
Mm.
you're new or a highly experienced caregiver, that we would have something for you. And if you want to look at self-directed resources on our website or sign up for one of our free programs, we have lots of different options. Take a look at what you need now, and then try and kind of store those things in your head or come back and visit later. I'd also like to make an honorable mention for social prescribing, which is something that we are doing in Ontario and other provinces are doing as well. Social prescribing is one of those things that we have excellent research evidence around the positive impact for caregivers and many other people, by the way. And it really is recognizing the whole person right? And that there may be other things that we need for our health and wellness. And you touched on this earlier in terms of loneliness and isolation. This is one of the major impact pieces that social prescribing can touch, connecting people with each other, connecting people in community. And we've got some great social prescribing programming, not everywhere in Ontario, but in some communities, that's making a huge difference for caregivers, even what we would call high intensivity caregivers, right? Who may have very limited time. There may be things that we can do through social prescribing that make a huge difference in someone's quality of life.
So peer support is really, really important. Can you define that term that you just used for the
Social
audience?
prescribing?
Social prescribing?
Yeah, so the social prescribing is really based on this idea that someone may need a pharmaceutical prescription, or they may not. Additionally, or distinctly, they may need a social prescription. And some effective social prescriptions can include things like being a part of a gardening club, right? Joining your euchre group, taking a walk in nature. And sometimes people hear this and it sounds kind of trite, but actually the research evidence is excellent about this in terms of the positive impact that this has on people. So we're involved in social prescribing for caregivers. Social prescribing is growing across Canada and internationally as something that people need. And it's a way that we can work in partnership with healthcare providers to connect caregivers with the support that they need, recognizing that it may not be a pharmaceutical support that they need. They need this social prescription for social activity and connection that works for them in their caregiving context.
Thank you for that. Our data certainly supports that, the power and impact of nature and animals on your mental health, et cetera, and many of the other things that you mentioned. I'm going to pause here. Amy, thank you. This has been a great chat. And again, I really appreciate you making the time for this today. I'm going to call upon my colleague, Shauna, to see if we have any questions from the audience. And Shauna, perhaps we could focus on caregiving questions initially, and then towards the end of our time here, if anybody has questions on our general poll results, maybe we could then address those just before the end. So any questions for us, Shauna?
Absolutely. Thank you, Amy and Akela. That was a great discussion. Moving into our question and answer session for about the next 10 to 15 minutes, and we're going to wrap it up just short of 3:30 p.m. We have been keeping track of all of your questions throughout today's session, but if you haven't had a chance to ask yet, don't hesitate to pop them in the chat, and we're going to do our best to get through as many as possible. So diving into our first question, I'm going to invite Amy to take the lead on this one. We've had a couple of questions come in about resources for caregivers outside of Ontario. Are there specific organizations or resources that you might direct our attendees to?
There are lots of great organizations across the country who are providing support to caregivers, Family Caregivers of BC, Caregivers Alberta, L'Appui in Quebec, Caregivers Nova Scotia and New Brunswick would be great examples that people can check out. And I actually saw in the chat that someone shared a link that will include all of those organizations and more. There are also great organizations for different types of caregivers, whether it's young caregivers. We have the Young Caregivers Association. We have siblings caregivers in Siblings Canada. So there's lots of great organizations who are supporting caregivers and also a part of this dialogue that's growing around the importance of caregivers and how they gain the support that they need in our national dialogue and our respective local and provincial work.
That's great. Wow, so many resources available. We just talked about the benefits of social prescribing. Are there any promising tools in development to support caregivers in monitoring and caring for their loved ones? Tools that will allow them to balance their own lives and responsibilities along with the caregiving?
Well, there are certainly people doing great work in this area, people who are focusing on things like caregivers and technology and how technology can be used as a tool. I would call out Ron Boleno, who's been a great leader in this area. He's provided some super resources and provides exceptional leadership in caregivers and technology. This is one of those things where it really has to be customized to your needs and circumstances. We have some tools on our website about this. Checklists, toolkits, places that people can start. And then this is also, Akela called this out, a great strategy that can come up in peer support. One of the things we want to do in peer support is connect people with someone who's had a similar type of journey and maybe further along in that journey than you, who can say, here's how I can help accelerate your process by sharing some of the tools, strategies, resources that I developed that make sense or that I utilize that are already available that might make sense in your circumstances. So they're certainly out there. And this is also where, and I see call-outs in the chat about a number of different organizations based on people's circumstances and what the needs might be of the person that they're caring for. Those organizations often have great tools that are relevant to that particular condition or set of circumstances.
Fantastic. Moving into our next question as a bit of a follow-up to that one. We love the use of technology and apps and telehealth, and we know that communication platforms can be a source of caregivers. In your experiences, where is technology useful and where does it still fall short?
That's interesting. Great question. I mean, I think technology can definitely be useful in terms of organizing the data and information that caregivers use. And, you know, I am a fan of keeping it simple. But I'll tell you, one of my most valuable caregiver tools is the spreadsheet that my sister and I have, where we track everything. And we have an interesting circumstance that's not all that unique, where I am local to where my dad is, and she lives on the other side of the country. So I do everything that's face-to-face, she does everything that can be done at a distance, and then we log and document that in one place. That's a really simple strategy that makes a big difference, because then if you're trying to remember who did what, where did it go, it's all housed in one place. So I do think keeping it simple is important, but I also think it depends on the digital literacy and the financial resources of the folks involved. I know that there are people who use a wide range of excellent technology tools that will allow for monitoring, especially if there are risks around, say, safety or wandering, those kinds of things, if that's relevant in those circumstances. And so, you know, those tools, if people have access to them, can be great. And we actually have some tip sheets on our website about that in terms of how do you evaluate the right tools for you in your circumstances.
Shauna, can I just jump in for a second there? Because I've seen a couple people in the chat ask a somewhat related question. Amy, tools or resources for employers to help employers identify or understand the challenges that some of their employees may be facing. Is there anything workplace related that you're aware of?
So we are certainly doing work in this area. We are doing it in two ways. One is to support working caregivers around how do you talk with your employer about your caregiving role and what you might need to balance work and care. We've got resources for that. We also have resources and programs for employers around how do you become a caregiver-friendly workplace and what does that look like in both policy and practice. So people can check that out on our website at ontariocaregiver.ca. The Canadian Centre for Caregiving Excellence is also doing work on working caregivers because I think, as you've called out, it is so important that employers actually see being a caregiver-friendly workplace as a valuable recruitment and retention tool. And, you know, we have a caregiver-friendly policy in our workplace. We have a caregiver policy that helps you understand what you can expect in terms of supports from us. We know there are other employers, large medium and small employers of different types of circumstances who are doing really interesting things, recognizing that an increasing number of people are balancing work and care. And so how do we keep you successful and engaged in the workplace while still fulfilling your caregiving responsibilities? You've got to have those policies in place. You've got to support your managers in having those conversations, and then it has to be put into practice.
Could be a topic for another webinar, a whole other topic. Sorry, Shauna, back to you.
No problem. Thank you so much, Akela, and thank you for that insightful response, Amy. Next question is on the topic of MHRC and our data collections. I'm going to invite MHRC's Vice President of Data and Partnerships, Michael Cooper, to jump on the line for this one. Michael, any plans for MHRC and how we continue to investigate the mental health of caregivers?
Thanks, Shauna, and great fireside chat. Yes, so we are in the middle of our 25th collection of data right now, and most of the data that that Akela shared was from our 24th collection. So we actually did a second collection, and we will be, with that larger data size, we'll be able to go a little deeper into looking into some of these questions. And I am keeping a running tab of some of the questions that have been asked here specifically to see if we can answer some of these questions. I'm particularly interested in this question around individuals who are both working and caregivers, or and we have seen, and Shauna, you've worked on a lot of these too, where you've seen a lot of this interest in the sandwich generation in terms of individuals who are both caring for elderly parents and children of their own. So certainly I think there is some opportunities here to use some of this information we're getting to take a look at this once we finish our 25th collection, which is coming shortly. Thanks.
Thanks so much, Michael. Always a wealth of information and looking forward to seeing the latest data coming out. Final question, going to open the floor to anybody who has any final resources, places for individuals to go if they're interested in learning more about the caregiving burden. Any resources that we might have missed, Amy, Akela, or Michael?
I mean, that's such a good question. I really would recognize that, you know, many organizations who are supporting people with perhaps a different diagnosis or a condition will recognize the person with that particular circumstance and their caregivers. And so I think it is really useful to connect with those organizations and find out what they have. And then the other thing which I would call out is looking at the health or social care providers that you're engaging with and finding out what their caregiver resources are. They may not be promoted, but they may have other supports that are available that are local to your community and your circumstances. And I think it can be really valuable to connect with those supports. Ask them if they have an essential care partner program and find out what supports they have as a part of that.
Thanks, Amy. And I would encourage, I'm sorry, Shauna, I didn't mean to speak over you there. I would encourage people to look at the chat. I see a lot of people have been very helpful in putting a lot of different resources and web links and websites in there. So there's quite a few in there, and I would encourage people to look at that. I'd like to end on sort of one comment, Amy, that I think you'll be able to relate to. We talked about the percentage of people that identify as caregivers, but we've also acknowledged that there are a lot of people who are caregiving, and that's quietly behind closed doors without acknowledgement, even to family members or even to themselves. And I just want to advocate for the power that all of us have as individuals to reach out and support the mental health of people in our circles, in our families, in our neighborhoods, in our communities, in our workplaces. So for those people who are perhaps caregiving quietly, for us to be able to reach out like we do to others and just make sure that everybody's okay, because sometimes that's all it takes is a helping hand, a phone call, a text, an email. If you ever need anything, I'm here. I know you've got a lot on your plate. I'm here. How can I help? I think that we all have a role to play in helping those within our circles and making sure that everybody is doing their best to focus on each other's mental health and wellness in workplaces and families and communities. And I know all of us probably on this webinar, visitors, guests, and panelists, and my team members, I know we all do that all the time. And I think we need to keep doing that and role model that and realize that sometimes a phone call or an email can make all the difference. So let's hope that people feel supported in our circles. And Amy, thank you so very much for making the time for this today. You're clearly a wealth of information. I hope people will visit your website as well as the many other caregiver-related websites that have been mentioned here in the chat. I look forward to continuing to partner with your organization. We believe in collective impact in mental health in Canada. We need to be working together as organizations across the country to try to move the needle and improve mental health for all Canadians. So thank you for making the time. Thank you to your team for everything that you do. And thank you to my colleagues for, as always, their excellent work. And with that, we'll sign off.
Thanks so much for having me, and thanks for this important conversation.
Thanks, Amy. We'll be in touch.